For the past several years, we've been dedicated to studying the uniqueness of delivering healthcare in a community such as Chestertown and Kent County. And throughout that time, we worked closely with our two state agencies, the Maryland Healthcare Commission and the Health Services Cost Review Commission, to create a framework that's kind of new and transformational, and that helps us provide high-quality, patient-centered care in rural Maryland. That was the first and important step. We have to get the two state agencies aligned with what our plan and vision is, and we needed their buy-in and support to make that happen. Then, now that we accomplished that, we've been building that framework over the past several years by listening to the community through community listening sessions, by meeting with our community leaders, and we've held many conversations with those leaders to get their input. But then we also talked to experts in rural healthcare from around the country and really got a good sense of lessons learned, best practices, barriers to consider and avoid, and just things that really help make their critical access hospitals effective in the regions that they serve. And while we were doing that, we received the NORC report from the Maryland Healthcare Commission. So we studied that report pretty extensively because we believe that's going to help us define options and best practices, not only for rural Maryland, but that report was centered on Chestertown and Kent County as well. And then the other real important document that we took a hard look at was the United Way of Kent County's Comprehensive Needs Assessment Report. That report was commissioned by the United Way. It was specific to Kent County, and it really helped us focus on the unique needs, and not just healthcare, but the unique needs of the community within Kent County and how we should be addressing those comprehensive unique needs. So from those reports that we received and from all the conversations we had, we've been formulating this plan over the past several years. And now that we've got all that information coalesced into a solid vision, we're ready to share our plans with the community. We're using the term that was adopted by the Maryland Healthcare Commission, and that is a Maryland Rural Hospital. That designation really aligns the Maryland state plan with critical access hospitals around the country. And what that means is that the hospital care and services is tailored to a rural region like Chestertown and Kent County, but it's connected to a larger system so that if higher levels of care are needed, that there's a seamless transition from one level of care to another. So specifically, when we're talking about the Maryland Rural Hospital, and it's similar to a critical access hospital, it's a hospital with inpatient beds. It's got up to 25 inpatient and observation beds that can be available for us to use for our community. It allows us to treat the appropriate levels of patients in that hospital facility, the mild to moderately complex patients, those that are typically in the hospital about 96 hours or less, those that are going to be seen safely, cared for safely, and either discharged home or to their where they came from, or safely to another higher level of care if needed within that 96-hour time period. And it really ensures that we have the resources and support to effectively care for those patients that we're seeing in the hospital. So that's really the uniqueness of the Maryland Rural Hospital. The components are very similar to a critical access hospital. And we recognize that we have a unique system of providing healthcare in the state of Maryland. And our state agencies were really supportive and instrumental in helping us be innovative with this new model of care, but they also wanted to make sure that it aligned with the vision that the state has for healthcare. We're not immune to some of the nuances of other hospitals and hospital systems within the state of Maryland. We're actually all under the same umbrella that as we operate and provide care in our communities. But this new model allows for some uniquenesses that bring or that are brought forth from rural hospitals. And it allows us to make sure that there are support systems in place that provide access to care and that provide high quality care for the patients that we're treating. The state agency that is still working through this is the Health Services Cost Review Commission. We are hopeful at their meeting in April that we receive the support we need from that agency to proceed. And from that information, then we are ready to launch our plan to the community. We have some internal audiences we'd like to share it with first, obviously. But then we intend to share it with our community in a variety of ways, in a variety of forums, including town council meetings and county council meetings, county commission meetings, but also with town halls for the general public to be able to listen in on. We've got 2 dates scheduled for those town hall meetings. The first is April 21st, and the second is April 29th. And we'll be sending out information with regard to those 2 town halls. And we hope that the community will listen in and ultimately provide us some feedback on our plans. And then over the next 5 years or so, once this plan is really launched on July 1st of this year, we perceive that over the next 5 years, our goal is to develop Shore Medical Center at Chestertown as the provider of choice for Kent County and for the region. We plan to do this through the adoption of our 2 new models of care, the Maryland Rural Hospital and the Aging and Wellness Center of Excellence, with a strong focus on providing high quality, safe, and patient-centered care. So that's our goal. 5 years from now, we want the community to recognize Shore Medical Center at Chestertown as the place for healthcare services.
What do you believe would be the direct benefits for the community with this new status and new operating process?
I think first and foremost that they will have hospital-based care right in their community, that they will have access to outstanding high-quality hospital-based care, and that they can have the confidence that they can go to the hospital for that care, for those care and services, from the emergency department, full service 24/7, to inpatient beds for admissions where appropriate. And if they have or need a higher level of care, that we have the access and the resources to get them to that higher level of care safely. Secondly, I think what I'd like our community to know is that we're not just focusing on the hospital-based care in Chestertown and in Kent County. Our mission at Shore is creating healthier communities together, and that focuses on the healthy aspect of our community. So the Aging and Wellness Center of Excellence is going to be designed to do that, provide support, services, and resources to promote health and wellness of the community. And I want our community to know that they can access these services to promote their own health and wellness and that of their families. So that at the end of the day, they maintain their health and wellness. They don't need to use the hospital-based services unless it's absolutely necessary. And we at Shore Regional Health realize our mission, which is why we exist, and that's to create those healthy communities. And with that,